In this morning's Health Watch, losing hospitals, schools, libraries, and courthouses. Now, those are all necessities, but a local hospital literally can make a life or death difference in some communities. CBS News correspondent Cynthia Bowers visited East Cleveland, Ohio, and a hospital that's been at the heart of that city for generations.
For 75 years, the sick and hurt in East Cleveland have come to Huron Hospital for help.
Just about everybody I know somebody that was impacted by that hospital being there.
Including himself. 7 years ago, Hank Smith was shot by drug dealers on the way home from his job helping veterans.
And I just thank God that that hospital was there at the time, because I really don't think I would have made it.
So imagine the shock when he and others in this impoverished community found out earlier this month that the hospital's parent company, the Cleveland Clinic, was closing Huron down in just a matter of weeks.
What happens when we knock on the door of Huron Hospital and nobody answers? Does the person just lay there and die?
East Cleveland's Mayor Gary Norton said he couldn't believe his ears.
We had the rug pulled out from under us. We believed that we had a long-term commitment.
With good reason. Huron Hospital President Dr. Gus Caius had invested millions in state-of-the-art technology, which, like much of the hospital, now goes largely unused.
Boy, it's like a ghost town.
Yeah, well, it is. There's nobody here.
Caius blames the dwindling population in his hospital on the dwindling population of East Cleveland, down by a third in the last 10 years. Adding insult to injury, Huron's patients are primarily poor, mainly reliant on Medicaid or Medicare.
Only 9% of our total is insured population, which is, you can't run a hospital with that kind of payer mix.
Cleveland Clinic CEO Dr. Toby Cosgrove says pulling the plug was the only option.
How tough is a decision to close a hospital?
Well, it's a difficult decision, but you have to do the right thing for the patient's care, and you have to understand that you are the steward of a community resource, and you have to use that resource wisely.
Cosgrove points to 17 hospital closures in Cleveland over the last few decades, but East Cleveland's mayor sees a troubling trend.
Hospitals typically don't close in wealthy areas where populations are relatively well insured. It is people in areas where the population is a little bit poorer.
The Cleveland Clinic isn't entirely abandoning East Cleveland. It is opening a $25 million health center here that will offer primary care but focus on chronic diseases like hypertension and diabetes.
How scared are the people of this community about the next phase?
Well, the people that we serve are used to being disappointed.
Longtime resident Hank Smith couldn't disagree more.
East Cleveland is a strong community, and we're doing everything we can to survive. And losing this hospital, I think, is putting a nail in our coffin.
There's talk of a lawsuit challenging the closure, but few expect the outcome to change. Just one more loss in a city that's been on the losing end all too often. Cynthia Bowers, CBS News, East Cleveland, Ohio.
The Cleveland Clinic promises free transportation to its main facility from East Cleveland for patients who need hospital care. Now, tomorrow we're going to look at a special place in Memphis where faith in the medical system is being restored.